I'm Tia Palermo, Associate Professor of Epidemiology and Environmental Health, and today I'm here with Alessandra Guedes, who is a Gender and Development Manager for Research at the UNICEF Office for Research in Innocenti. She has dedicated 20 years of her professional life to promoting children's and women's rights and health, including working intensively to end violence against children and women. She joined UNICEF in 2019 to lead the development and implementation of a research program to address key issues and constraints to achieving gender equity within child protection, with a particular focus on linkages between violence against children and violence against women. Prior to joining UNICEF, Alessandra served as the World Health Organization's Regional Advisor for the Americas on family violence prevention. Welcome, Alessandra.
Thanks, Tia. Nice to be here.
Really great to have you. So first, can you just tell me a little bit about your background and how you ended up at UNICEF?
Sure. And I have a sort of unconventional background, if you will. And I don't know how far back you want me to go, but my undergraduate is actually in art, studio art. And following that degree, I decided that I wanted to go into art therapy, so mental health and art. So I went straight in from my undergraduate degree to a master's. At this point, I was in the US in art therapy. And I worked in psychiatric hospitals, and I worked in psychoeducational programs. I worked with both children who had experienced a lot of adversity, as well as perpetrators of pretty heinous acts of violence. The hospital in which I worked had a maximum security prison for those who had pled guilty by reason of insanity. So I did that for a bit, and I'm from Brazil originally, but at that point I was living in the US. And after I finished my master's in that very intense experience in mental health, I went back to Brazil, and by chance, kind of looking at what I was going to do next, I got a job in sexual and reproductive health for adolescents, working with UNFPA in Brazil. So I packed my bags, moved to that, and loved the area of public health. So I did that for a couple of years and felt that if I wanted to stay in that area, I needed additional training. So I applied for a scholarship, and I ended up at the London School of Hygiene and Tropical Medicine, where I obtained another master's in public health. At the time, they called it public health for developing countries. And then straight out of that, during that time, I started to research abortion laws and policies, particularly in Brazil, and had been in touch with International Planned Parenthood, whose office was based in London. His main office was based in London. Anyway, to make a very long story short, I got a job at International Planned Parenthood Federation out of that master's in their office that covered Latin America and the Caribbean. And that job was to integrate services for women who had experienced violence within Planned Parenthood clinics in the Latin America and the Caribbean region. And so that's where the beginning of my road in terms of the work on violence and public health and mental health started.
That's so interesting, and it's really interesting that you got to work on the ground in programming, kind of integrating services for Planned Parenthood. And what about now at UNICEF? Can you tell us maybe a little bit about the work that you did at WHO and then how you ended up at UNICEF?
Sure. So I worked for International Planned Parenthood for about 5-6 years. At that time, I was based in New York. And then I decided to move back to Brazil again. I got married and I had my kids. I have 2 kids. And while my kids were little, I was working as a consultant from home within the area of women's sexual reproductive health and rights, violence, etc. And then at one point, after I had been sort of out of the formal job market for about 5 or 6 years, I saw a position advertised at WHO at the Regional Office for the Americas, which is known as PAHO. And I looked at the position description and I thought, this really matches my experience and my CV, and I'm just going to see how marketable I am, after having been out of the formal job market for a bit. And I applied and I didn't hear for a long time. And then I got invited for a phone interview. I did the phone interview. I thought I had done lousy in the interview and I was very embarrassed, and I never heard from them again until 6 months later, they offered me the job. And so I remember getting the offer and thinking, I think this is a joke. I thought that they would ask me back for like an in-person interview. But no, that was a job offer. And we wanted our kids to have the experience of living abroad. So I decided to accept that position. I spent almost 10 years at that office as the regional advisor for both violence against women and violence against children. As you know, WHO works very closely with ministries of health. We follow the mandates that are set for us by ministries of health. So in that role, my job was to strengthen the capacity of health systems and healthcare providers to identify and provide compassionate and effective care for survivors of violence, and to, at the same time, work to prevent those forms of violence from ever taking place. So I traveled the whole of Latin America and the Caribbean, working with governments. Of course, we know that violence is a multidisciplinary issue, and it requires a multidisciplinary response. So even though as WHO, our main partner is always the Ministry of Health, we had to necessarily work closely with women's ministries and other parts of not just the government, but of civil society to advance services and interventions to prevent those forms of violence. So after doing that for about 10 years, I was offered the position that I have now at UNICEF. And here, as you know, Tia, very well, having worked here as well, that the focus for this office of UNICEF is on research. So whereas at WHO, I was doing both research, but also programs and doing a lot of policy development and developing evidence to support policy and program responses. Here, our role is more restricted, let's say, to research and to generating the evidence and to facilitating access to that evidence so that colleagues who are working more on the programmatic side can use that evidence to improve programs on the ground.
That's great. And perhaps for our students who may not be that familiar with how some of the programmatic work is, can you maybe give us an example of something you did? So you mentioned that you worked with ministries of health. Can you tell us a little bit about an example of one country you worked with and what that looked like?
Sure, and maybe I can tell you a little bit of an example that sort of, I always think it's a good example of how to go from generating the evidence all the way to sort of policy and program. So at WHO has a central office, a headquarters that's based in Geneva, and then we have the regional offices, and I worked in one of them. But I also worked quite closely with headquarters, whose mandate is to establish evidence-based guidelines and normative guidance to support the work of ministries of health. So as part of that process, I was involved in the development of guidelines for the health system on how to respond to intimate partner and sexual violence against women. So I went through the whole process, obviously with a group of people, on identifying the existing evidence, assessing the quality of that evidence, turning that evidence into a set of guidelines. And if you've come across WHO guidelines, they're excellent, but they're not always user-friendly for those who are, at the end point of providing services or even developing evidence. So once we had the evidence, the guidelines, we transformed those guidelines into a very user-friendly clinical handbook for healthcare providers and for healthcare policy managers. And we used that handbook to work side by side with countries to look at what they were doing at a national level, what the protocols looked like, what the gaps were, where the protocols needed to be tweaked so that they responded to the evidence. So in one example, we had a global project working in Uruguay, which was under my area of responsibility. And then I'm going to forget the other two countries. So there were two other countries that colleagues were involved in. Apologies, I don't remember which ones they were at the moment. But so Uruguay, we worked over a year and a half with the Ministry of Health, the Ministry of Women's Affairs, civil society organizations that were working on violence against women to pilot that clinical handbook with their healthcare providers. And over the course of a year and a half, they tweaked and they adjusted that protocol so it suited their health system and their needs and mandates, so that by the end of that process, they adapted and adopted that clinical handbook as their national protocol for guiding the health system response to women who had experienced violence. And they went on to train healthcare providers across the country on how to use that protocol. And so it was a process that we went from the very early stages of doing systematic reviews to look at what the available evidence said, to bringing together a group of experts to weigh in on the quality of that evidence, to weigh in where there were evidence gaps, to create the guidelines, the clinical handbook, and then to take it to the ground so that it really reformed the national system response. And then we went on to create some additional tools to support that effort, including a manual for health system managers, because we know that part of the effort has to take place with healthcare providers themselves, but they need to be embedded into a system that allows them to have a private space to talk to survivors, to have confidentiality of the health records and so forth. And then the next step to that process was actually to create a curriculum for healthcare providers, building on that all that experience that we had done of piloting the handbook and working closely with the governments, so that now we have an evidence-based curriculum for healthcare providers. So that kind of gives you a little bit of the full circle of the process of going from evidence to changing policy on the ground.
That must have been such a rewarding experience, to start with the data and synthesizing the evidence all the way to providing tangible guides that can help practitioners in their daily work. You've been working in this field for about 20 years, and have you seen any changes, or when you try to come in and work on the topics of violence against children or violence against women, do you find resistance? Are people eager to work on this work, or do you sometimes find resistance? And has this changed over time at all?
Yeah, so I've been working for over 20 years, and I think that the political relevance, the way that the issues are mainstream in the development agenda is incredible. I mean, when I started to work on this, it was, we really had to make the case and prove that this was not just a human rights issue, that it was also a public health issue. And we had to, we didn't have evidence on the prevalence at that point. And we often say, when the Millennium Development Goals were being drafted, there are a lot of people who were trying to get the issue of violence against women as part of that global agenda, and they weren't able to, in large part because we didn't have prevalence data to show, the magnitude of such violence. I mean, we know now that 1 in every 3 women globally experience intimate partner violence. That's physical or sexual. If you add emotional, that number goes even higher. We know that, upwards of 50%, that's 50% of children globally experience some form of violence in the past month. So, when you have numbers like that are quality numbers, solid numbers, it's hard for the issue to be dismissed as a problem of, a particular population or a particular country or a particular socioeconomic level. So that change is palpable. Having said that, I will say that I find that the level of funding, the level of commitment to these issues are still not commensurate with the size of the problem. And, one would think with all of the headlines that we see on the papers, and you see, often celebrities coming and talking about the issue, it would make one think that the funding has followed, that the political priority has followed. In some cases, in some contexts, it has, and in some, it hasn't. I would also say that, without getting too much into the details of this, but what we have seen across the globe in terms of a pushback on certain rights and advances, particularly related to women's rights, to sexual reproductive health rights, to LGBTQ plus rights. As we see some pushback against achievements that we were almost taking for granted or assuming that they were there to stay, that's scary. I think to me, the message is we can't take these rights for granted. We can't take these advancements for granted. It's a constant battle to move forward, and at the same time to prevent us from sliding back. So yes, the issue is definitely, much more visible than it was. Evidence of that is how violence is seen across the Sustainable Development Goals, not just the ones on gender, but, really across 5, 16, and so forth. So that's clear, but that does not necessarily mean that we have the backing and the funding that's needed to effectively address these issues.
So maybe now we can take a little bit of a step back. Can you talk a little bit about the definition of violence against children? So you talked about some prevalence estimates, and estimates indicate that as many as 1 billion children around the world are experiencing emotional, sexual, or physical violence every year. So can you talk about what is the definition of violence against children, and what are some of the types of violence that they experience?
Yeah, and I think, as Tia, we could spend hours going back and forth on definitions and what's right and what's not. And there really isn't consensus per se. There's somewhat agreement, but in general, we use violence against children to mean any violence against a boy or a girl under the age of 18, including child maltreatment, physical punishment, being the most frequent forms of violence. So we're talking about physical, emotional, sexual forms of violence. It doesn't matter whether it takes place in the home or in the school, or whether the perpetrator is known or not known, or whether the perpetrator is a family member or not. What we know is that by and large, children experience violence from those that are known to them. Having said that, there are new frontiers, if you will. We know that there's a lot of violence and cyberbullying that's happening in children's digital lives as well. Then there are other forms of harm to children that are sometimes included as part of violence against children and sometimes not. For example, female genital mutilation, child early enforced marriage, child labor. So there are different ways of cutting the pie, if you will, but basically the umbrella term violence against children is used to describe any behavior that has the potential or is in fact harmful to children, regardless of the space over it happens.
Thank you so much for that. And can you talk a little bit about what you do at UNICEF around these issues?
Sure. So UNICEF, at UNICEF Office of Research Innocenti, I work within a team that's called the Child Rights and Protection Team. We're trying to come up with a cool acronym for the team, and right now it looks like it's CARE, Child, Adolescent Rights and Empowerment. And so this is a really great group of people who are working on a number of issues. I lead the work on violence against children, and within that, I focus a lot also on the intersections between violence against children and violence against women, and looking for ways for us to move towards a more gender transformative approach to addressing violence against children and child protection. And I can tell you a little bit more specifically some of the work that I'm doing in that, but just to say that that team also has amazing colleagues who are working on issues like child labor, migration, gender responsive and age appropriate child social protection, the list goes on, birth registration, etc. So all of the work within the office that falls under child rights and protection falls under this team. Specifically within the work on violence, I'll give you a couple of examples, keeping in mind that I've been there for now just a little bit over a year and a few months. So last year, as one can imagine, our whole portfolio shifted to address the pandemic and the focus on the pandemic. And, one might think, well, COVID, violence, what's the connection? I thought COVID was, an issue that affected respiratory systems. And so I'll tell you a little bit about why violence is linked to COVID. To start off, we already know that the levels of violence against children and women are extremely high even before the pandemic. So it's not that COVID caused violence. Violence existed and has existed long before COVID. However, many of the measures that are necessary to contain COVID, including lockdown measures, closing of schools, have the possibility of increasing risks that are associated with violence against children. For example, in economic downturns, increased levels of stress, increased use of alcohol because of that stress, all of those factors that are associated with perpetration of violence. At the same time, some of our frontline levels of reaching, of identifying children who may be experiencing harm are off access. So schools often function as one of those first layers, where teachers and other professionals at school can identify something that may be off with a particular child and can access the support that's needed. And if that's not available, then you may find children and women who are stuck in abusive homes without the possibility of accessing the help that they need. So last year, we spent a lot of time raising awareness about the risks that COVID imposed, not just to all of the things that that we are aware of in terms of health and the economy, but also to violence. So we wrote think pieces, we wrote op-eds, we did a very large online seminar. We worked with colleagues to say, what are governments already doing? Can we disseminate that information? Can we advocate so that government responses to COVID take into account these risks of violence? That includes, for example, identifying services that are providing care to survivors as priority services, so that those professionals have access to the equipment that they need so that they can remain open. So there was a lot of work that we're doing in that way. The other issue that concerned us last year is that, a lot of colleagues understandably wanted to measure, okay, so if COVID can increase the levels of violence, by how much? What has been the impact of COVID on the levels of, for example, physical punishment of children or intimate partner violence against women? And there were some initial efforts to try to get quick ways of assessing that level of impact. However, what we know about researching violence against children and against women is very clearly states very clearly that we need to abide by certain ethical and methodological lessons that we have learned over the last decades of doing this kind of research to guarantee, first and foremost, the safety of respondents. But also we know that if we don't ask the right questions, if there is no privacy and confidentiality in the process of asking those questions, if we're not able to offer adequate response to those who reveal their experiences, not only can we be doing harm to those respondents and to our research teams, but we can also be producing data that's underreporting, because if people don't feel comfortable, if they don't feel that they have privacy in telling you their experience, they're going to underreport levels of violence. So one of the things that we did is work with colleagues to produce guidance to say, hey, if you're going to be researching this under lockdown conditions, wait a minute, these are the things that you should be considered. This is what needs to be in place before you can move ahead. If these conditions are not in place, don't do it. And then we had to offer an alternative, right? If we're saying you can't collect primary data at the moment, what can we do to be looking at how COVID is impacting the levels of violence? So a colleague of mine, Claudia Kappa, in UNICEF headquarters, did some really interesting work looking at big data, for instance, data coming out of Reddit and other social media platforms to see increases in help-seeking behavior. She also looked at helpline data to see, were we seeing increases in helpline calls? Those data don't mean that there are increases in the actual incidence, right? We may be seeing an increase in help-seeking behavior and not necessarily an increase in incidence, but we were trying to get to as close as we could to understand the impact of COVID on the levels of violence. And then jointly with colleagues from the London School of Hygiene and Claudia, we did one paper looking at modeling. So how can we use existing data sets? In this case, we looked at the mix, the multiple indicator cluster surveys, and to estimate, knowing what we know about how the pandemic is impacting these risk factors that we also know are associated, in this case, with physical punishment of children, how much can we anticipate that the pandemic could raise the levels of physical punishment of children? And we used 3 countries as studies to look at that. So to say that in last year, a lot of our work focused on COVID and violence, both against children and against women.
Wow, that's really important work. And as you know, it's fraught with challenges around, the need for the data so that you can galvanize the resources to address the problem, but also balancing the ethical side of, can you safely collect this data in a way that's not going to harm the women and children who are experiencing that violence? So really important work. It's great to hear about all that you're doing. Can you tell us a little bit about some of the consequences of violence? So we talk about the prevalence of violence, and we've talked about some of the risk factors, and we've talked a little bit about the different types of violence. But in addition to it being a violation of children's rights, what are some of the other consequences that children might suffer from either experiencing violence or witnessing intimate partner violence in the home?
Yeah, Tia, and that's, where it gets, where we have to be a bit specific, because, as we said in the beginning, violence against children can encompass such broad behaviors and broad experiences. So we need to be thinking about, okay, what type of violence and what are the consequences of that specific type of violence. But broadly speaking, what we know is that the experience of violence early in life can lead obviously to injury. Those are the most obvious consequences of violence, and head injury or burns or internal injuries and all of that. But we also know that it can lead to a whole host of negative mental health outcomes, including depression, anxiety, post-traumatic stress disorder, all the way to suicide, ideation or attempt. another whole area of consequences have to do with children's development, even educational attainment, right? We have studies that show us that when children are exposed to violence early in life, that may have an implication in terms of their educational attainment down the line. And then there are all kinds of new research that's coming out that's fascinating and connecting early experience to violence, to even non-communicable disease and risk behaviors in adult life, including heart disease, diabetes, alcohol, smoking. So, I think the more we learn, the more we see how broad and extensive and far-reaching the consequences of violence can be. And I think in this context, it's really important to say that if you experience violence in life, we are not saying that you will necessarily experience these consequences. There's a lot of factors that can mediate the impact of a negative experience early in life. And I think that that's one fascinating area of research too, looking at resilience and why is it that perhaps two children can experience relatively similar negative experiences early in life, and one can fare perhaps better than the other. What happened there? How much of that is innate? How much of that can we modify? Because obviously that would be a really important area of intervention, given how many children we know who have already experienced violence. What are the interventions that we can put in place so they will mitigate the negative impact of those experiences of violence? So again, just to say, a risk of experiencing those negative outcomes does not mean that you necessarily experience those negative outcomes. It means that you are at a higher risk for those outcomes. And you mentioned witnessing intimate partner violence. And that's a really interesting area of work, and one that I've been looking at for a while, because as you know, the fields of violence against women and violence against children for a long time, and to some extent to this day, we're working in very parallel ways. So there's a whole body of research around violence against women. There's a whole body of research on violence against children and different colleagues that may or may not interact. But as the evidence is coming out more and more, we see how these forms of violence intersect in interesting ways. And I say interesting in the sense of, if we have shared risk factors, then it means that maybe if we can develop interventions that will impact those shared risk factors, we could potentially, with one intervention, address both forms of violence. But what we know from children's experiencing or children witnessing, usually it's children witnessing violence against their mothers or their stepmothers, is that the consequences of that witnessing are similar, and in some cases even stronger than if children experience violence themselves directly. And across the whole range of consequences that I mentioned, emotional, mental, educational attainment, etc. And what we also know is that children who witness violence against their mothers early in life, for boys, they have a higher risk of perpetrating violence against women and other forms of violence later in adulthood, and women have a higher risk of experiencing violence in adulthood within their intimate partner relationships. So, it's what's been called this intergenerational cycle of violence, where unless we figure out how to break that cycle, if we know that children who either have experienced violence directly or who have been exposed to violence are at higher risk of those negative consequences, what interventions can we put in place so that we break that cycle and mitigate as much as possible the negative experiences that they may come to suffer?
Wow, so really important to address violence, not only for the human rights aspect and the negative consequences for children, but also really important to stop that intergenerational cycle of violence. You talked a little bit about the very important work that you're doing on COVID-19 with UNICEF. Is there anything that you are currently working on or planning to work on in the next year or so with any country offices that you're particularly excited about? Can you talk a little bit about that?
Yeah, so we there's a whole bunch of things, but I'll mention a couple of things. So one of the things that we did last year, we worked with UNICEF colleagues from the child protection field and from the gender group to develop a paper on the gender dimensions of violence against children and adolescents. And the idea behind this paper is not just to bring together the evidence that we're discussing in this conversation, but also to point ways forward for UNICEF so that we can, as an institution, move towards a more gender transformative approach to child protection, to violence against children prevention and response. And the paper just came out this week, so I'll send you the link in case your colleagues want to take a look at it. And that paper really is guiding our way forward. And so some of the things that we're working on, we're collaborating with the Sexual Violence Research Initiative and with the World Health Organization on developing a shared research agenda on the intersections of violence against children and violence against women. So we are starting with a series of systematic reviews with the paper that I've just mentioned, and we're going to go through a process of a number of consultative opportunities with a wide and diverse group of people from around the globe to identify, what are the gaps that exist, what are the priorities for us to fill in terms of those gaps, so that by the end of the year, we will have a global shared research agenda for the intersections of violence against children and violence against women that will guide not just our work, but hopefully the work of funders and colleagues who are in the academic field. We are also collaborating or starting to collaborate with the WHO and the London School of Hygiene, because one of the things that I'm hearing a lot from colleagues on the ground, both from UNICEF but also beyond, is, okay, we've made the case that these forms of violence intersect, that we need more evidence for certain gaps, but it's clear that we need to work differently, that we need to work in a more coordinated way. How do we do that? What's the minimum that a child protection system needs to do when they identify a child who's experiencing violence, given what we know about the co-occurrence of child maltreatment and intimate partner violence? What's the minimum that a child protection system has to do to look at what's happening to the mother in that household? Conversely, if you have services that are providing care to women who are experiencing violence, and you know that the likelihood that children in that household are experiencing violence are high, what's the minimum that they need to do in order to provide a first level of care to children in that household? Tia, we work with countries that in many cases have really overstretched systems. It's not as though we have an abundant and really well-served child protection system, or really anywhere. I would say even in high-income countries, those are not really necessarily systems. But how can we strengthen them and move them into a direction that responds to the evidence that we know? If you're caring for that child, unless you're also caring for that woman to some level, your intervention may not be very effective. And similarly, if you're providing great care to a woman who's experiencing violence, but you're not looking at what's happening to the child in the household, then you're missing a big part of the picture. So with WHO and the London School of Hygiene, we're trying to understand how countries on the ground are already doing that. Our colleagues at the EAPRO region, UNICEF, but also UN Women and UNFPA were involved in a multi-country study trying to get a sense of, okay, so how do these systems react when, how a child protection system reacts when they see a woman who is experiencing violence. So we gathered some evidence from that. We produced a report, and we're trying to see how we can take it to the next level and identify what a minimum level of response should be across the different systems to provide guidance to colleagues who are on the ground so that they are strengthening their services in that direction. Because what we know is they're already faced with this challenge. They're just sometimes at a loss as to how best to respond, considering the limited resources that are available to them. So that's an area that's incipient, but that we're working on. And then there's a whole other area that I'm involved in that has to do with strengthening networks and strengthening capacity to generate evidence and to use evidence for policy and programming. So as I mentioned, I'm a part of the Sexual Violence Research Initiative. I'm the co-chair of the leadership council of that initiative. And so a lot of what we're doing is strengthening capacity in the Global South, primarily for this kind of work. I'm also involved in a Lancet commission looking at gender-based violence and youth maltreatment. And within that, one of the areas that I'm helping them look at is youth involvement within that commission. And we're still trying to define our portfolio, but very involved in that as well. And then I'm also I'm part of so many commissions, sometimes I get them confused, but also another group that I'm involved in. 2 years ago, there was a meeting at Wilton Park in the UK, organized by then UK DFID and Wellspring, to look at how we can use the evidence around violence against women and girls to accelerate progress. And so I'm involved in a group that came out of that Wilton Park meeting to advocate for evidence-based program and policy making, and to also advocate for greater investment in evidence that will fill the gaps that we have at the moment. There's more, but I'll stop at that.
Wow, that's a lot of really interesting work, and it's great to hear that you're working horizontally across different partners and UN agencies, but also vertically within countries at the national level and on the ground. I guess one of my last questions for you is, you've talked about resource and capacity challenges. Are there any other challenges that you identify working in this field of violence prevention and response?
So from a personal, I'll respond to that question from a personal level. I'm not sure if that's how you intended it, but I will do that. And I think I would say that when I started here, I think one of the challenges that I felt is a little bit of an exhaustion of constantly having to make the case for something that for me was so obvious, so constantly have to say, this is a big problem, this is a public health problem, this is a human rights problem, this is a development problem. And I still do, don't get me wrong, there's still quite a lot of that advocacy that needs to take place. Similarly, it can be very frustrating that there isn't commensurate funding that's commensurate with the size of the problem. I often say, if you had a health condition that can be as devastating as the experience of violence is for children or for women, affecting half of the population, would we be getting a different kind of response? If I said, for instance, that, I don't know, HIV affects half of the population or malaria affects half of the population globally, would we get a better response? And I think we would, So that can be challenging. The other thing that I think is challenging is that, for me at least, is that this is a really heavy topic. This is probably humanity at its worst. You're reading all the time about sexual violence and physical violence and emotional violence, and oftentimes perpetrated by those individuals who are supposed to be protecting and loving and caring, whether it's a partner or a caregiver or a father or a mother. And I think that really takes its toll over time. Sometimes I have stuff that I have to read over the weekend, and I have the best of intentions, and I open a paper and it's about, sexual violence against children, and I say, I just can't, look at this anymore. So in my personal time, for instance, I don't see anything that has any level of violence. I don't see a movie that has violence. I have walked out of movie theaters. I don't read anything that has violence. I really, it's as though my threshold has been filled to capacity for a couple lifetimes. And that's hard. And I don't know that I think that there are different people maybe experience this differently, or who may find effective outlets for all of that emotion. I think at different points I've had different outlets, but overall I find that it's very draining for me emotionally. I absorb a lot of that. The upside is that, truly I have met some of the most courageous, dedicated, hardworking, smart, people in the world. And in the violence against women field, by and large, they tend to be women. And so that there's this sisterhood, which I have valued so much. Really, it's so incredible. And on the child protection, equally amazing colleagues, perhaps more of a distribution between men and women. And so I draw inspiration from them and energy from them. But there are times where I think maybe I should have gone into interior design, maybe I should have done something that was lighter. Maybe, I don't know, maybe when I retire.
Wow, yeah, I can imagine the emotional toll that must take on you. And really I want to thank you for the work that you're doing. It's so important, and it's so great to see someone like you really diving into this work and sustaining it over so many years. It's making a difference for so many people. So thank you for the work that you're doing, and thank you for the time that you're taking to talk to us here at the University at Buffalo. Is there anything else that you'd like to add before we wrap up?
Just to say thanks to you, Tia, for all your great work, because I think you bring, a different set of skills and eye to the issue through social protection and economic empowerment, which is so needed. And then to say, I truly stand on the shoulders of so many amazing people who have come before me. So I'm a tiny, part of this bigger whole of amazing women and men working on it. So any of your accolades are shared with them.
Well, that's wonderful. And in the vein of taking care of your mental health, I don't think we mentioned to our viewers that your office is in Florence, Italy. And so for your mental health and for my purposes of nostalgia, please take a stroll around the Duomo and have a cafe and a budino di riso for me. So thank you so much for joining us.
Yeah, no, absolutely. Being surrounded by nature and beauty is really very healing for the soul, for sure.
It's a beautiful place. Thank you so much. Take care.
Thank you. Bye.